I was raised by a psychiatrist in New York City, two parents that were both very psychologically oriented and loved Sigmund Freud. We grew up with a lot of Freud. And I was good in science. I was a science nerd, so I was always going to become a doctor. And I was on that track since I was about 3, and it got me a lot of positive feedback. So I never stopped to think about it until I was pre-med in college. And I started to really, when you start, your sort of reflective capacity comes online. And I kind of knew that wouldn't suit me. And I thought, what's like it? Because I was worried about being too anxious. Frankly, I was an anxious person, and I didn't want to deal with death and dying. So I thought, what's similar to medicine but without the death and dying? And that's how I came to dentistry. And I applied to both medical and dental school because I had to prove, that I could get into medical school. Because in Jewish families where there's a doctor, there's some issues with becoming a dentist. But I ultimately decided to become a dentist. And that was great. It really informs a lot of my work because the first 2 years are knowing I was with the medical students at Columbia. And so I think everything I learned about the physiology of the human body really made me ripe when I first had exposure to emotions at an attachment conference back in 2004. But to make a long story short, I did dentistry for 1 year after graduating, just to make sure I didn't hate school, but I really didn't like being a dentist. It didn't suit me. And then I cut my losses, which was very hard, and floundered for about 10 years. And then after 9/11, had sort of an epiphany that I wanted to become a psychotherapist, which I think I always did, but I can't imagine doing that at the age of 22. A lot of people do have the confidence, but I just didn't feel like I had anything to offer at that age. And so I went back for a master's at Fordham, and then I knew I was going to go right into psychoanalytic training because in Manhattan, that was the sort of creme de la creme of being, the most sort of trained in my mind. Again, that's how I was raised. And then right before I was going into analytic training is when a friend of mine mentioned that I might like this woman, Diana Fosha, and I Googled or looked for where she might be speaking, and that's when I found this full academic conference on emotions and trauma, and where I first had exposure to the triangles and to trauma theory and to attachment theory and to infant mother research in this way that it was put. And I was so blown away by two things. One, I had the best science education. I went to Bronx High School of Science. I was a biochemistry major at Wesleyan. Then I went to Columbia Medical School in all essence for the first 2 years, and then dental school. And I had never, and I read, where was this information that seemed to be cordoned off in a very small group of academics and practicing psychotherapists. So that was the first thing that was conspicuous. And then I saw the triangle on a slide, and I immediately felt transformed and organized. And I had gone through 2 major depressions from situational stress, and I had been anxious my whole life, although I didn't know it because I was defending against it with productivity. And I thought at the time I saw the triangle of conflict in particular, which was billed as the triangle of experience through Diana Fosha's lens, that this was a public health tool. I didn't really understand why we couldn't get this in high school, basically. And so then flash forward, I went through analytic training because I needed to legitimize myself that way. And I simultaneously started reading, training in AEDP and reading voraciously on trauma theory and learning SE and EMDR and somatic sensory experiencing and Eugene Genlin's work and Gestalt. I just couldn't get enough, and ultimately became a certified AEDP therapist and supervisor. And then about a decade into practice, I wasn't a writer before, but I felt I had a story to tell about the work. And then I wrote that article that the New York Times published, which was just a wonderful shock. I really submitted it blindly, never thought it was gonna be published. And then because it went so viral, I was like, okay, I didn't think I was the only one that this stuff would resonate with, and then I really started to get jazzed about sharing it with the world. And then I got asked to write the book. I didn't seek it out. So it was like the luckiest thing in the world and wonderful. And they said, what do you want to write on? And I was like, well, there is this triangle that I want to share with the world. And that's how it happened. And then I become more and more passionate about sharing emotion education with the public as I practice psychotherapy and as I supervise it as well.
Well, and I want to hold up the book so everyone could see it. I think there's a new cover now, but it's not always depression as the book. And of course, I remember the article because my father reached out to me and said, have you read this article? And that was the first moment that I've ever heard my father talk about psychotherapy with me. So if it made such an impression on him, I knew that I had to really pay attention to you and what you would be doing, and the book arrived. Yeah. And now it's translated in how many different languages and in what countries?
Lots. And I think the cover hasn't changed for that. Oh, okay. It's in the UK. There's a black and white cover that's now changed to a blue and white paperback. And it's in Chinese and mainland China. It's coming out. In Taiwan, it's already out. It's in Polish and it's in Lithuanian, and it's coming in Spanish and Japanese, and it's in Korean as well. So, and more, there's hopefully more and more, but it's thrilling. It's thrilling. And mostly it's thrilling because it's helping people. And I get, emails and have connections on social media that people share what it means to them. And again, what it's meant to me. And, I think we're all of us here, the understanding emotions in this way has helped us personally and professionally.
Absolutely. I mean, I think all of us truly do understand how emotions can help us personally. And then of course we want to share it with our patients and our family members and even other colleagues. And, one thing that I've seen about your work is that you're really bringing emotion education to the forefront. And so, a subject that's been neglected is now really being paid attention to. And so, through your blog, you're always coming up with really interesting entries that kind of bring people together and allow them to be more open about emotions. And I know two of the major topics that you've really have pressed upon with the public is just how important expansive, adaptive emotions are. Mm-hmm. And I was hoping that you could talk a little bit more about that. But you've also have brought to light the power of the hug too. And so I was hoping that you could speak on both of those topics. Yeah.
Yeah. Well, first, so again, I just want to be very clear in that I didn't invent anything new here. I'm a translator of everything that I've learned from other people, and the book has a long reference list. It's interesting when you write for the public as a self-help book, there were all sorts of citations in the book, and Random House is like, no, just put them in the back. But I haven't had any original ideas, although my ideas have formed, like all of our ideas. Do you want me to launch in and talk about?
I think, Hilary, I mean, this is something that's so important. All great artists will say that. I mean, we all learn on the shoulders of others, and you've been able to write a book that's just so easy to read, and allows it to be accessible to so many different types of people, not just people in the field, and that's a huge contribution because not everyone has that gift. And so I know that you learned along the way the importance of expressing yourself in a simple, kind of straightforward manner, and it's just been so helpful to people over the years. Yeah.
Thank you. That I can take in the spirit of expansive emotions. I do feel proud of that, and the goal was really it really was going to be directed to the public. even though I know probably about half the people who are buy the book are in the field of counseling and psychotherapy. And the idea was really, I was imagining that somebody that around the age of 14 could understand it. And I need books that like pull me in really fast. So I tried to make it like a beach read. And the interesting challenge, that we all have with the emotions as psychotherapists, but also as writing about this, is you can't think your way through an emotion. So how do you give a lay reader with an experience where they can absorb it so it's not in their face? And that's why the book needed stories. So it's to give someone a vicarious experience where they can take what they want, not preaching to anybody, not saying experiential therapy is better than CBT or putting anybody away from it. I really just wanted to offer an easy to understand and moving book that people could read or listen to and just feel like they may not want to go any further than just understanding emotion education, which I think is so important, because if you demystify emotions and you make them less scary, then people can lean into them, just like in our practice. That's the idea, is to make it safe to just do a little bit at first. And then as that goes well, to do a little bit more, and then a little bit more. And then the next thing you know, somebody is really beginning to work the change triangle, as I say. I nicknamed it, again, this idea of just nicknaming it and make it, put in it's like a basic emotion education that we should be getting in high school, but in a book. So I didn't talk about other emotions and nuanced emotions. I didn't talk about relational emotions like love and longing, which I'm very interested in. But I have become more and more interested in this concept of, because in ADP, we have this kind of thing that was called preferencing the positive, and not in a kind of positive rah-rah type of way. That we just had an interesting query on the AEDP listserv about Pollyanna type of a way of thinking versus what it really means to lean into positive affect, really. Go ahead.
Yeah. So, I mean, what positive affects do you find yourself working with the most right now? Like, what do you think people need to learn at this moment in time?
Yes. So this may be surprising. So I'm talking about affect that viscerally makes you feel bigger. So I'm talking about anger, which is my favorite emotion to help people with, because it's the one that it's a big one for people to struggle. All the expansive emotions I'm finding are the toughest ones to lean into. So I know someone's just saying anger is a positive affect. That's why I'm changing the model. Let's not call it positive. I want to call it expansive affects, where the energy, where if you're with it, there's energy that's coming up and out and you feel bigger and more powerful. Anger, pride in the self, joy, even gratitude, right? As opposed to like things that make you feel smaller, like shame. And even, when I'm sad, my visceral feeling is to kind of curl up into a ball and be held. So as a therapeutic idea, when somebody gives me an entryway, and we can keep anger out of it if it's too controversial. Let's just talk about pride in the self for a moment. Somebody tells you something good that happened at work, or they received an award, or somebody complimented them, or maybe I said something good and I see a reaction, something complimentary or affirming. To take that moment and have somebody, and really make an invitation, that's so important, what you're saying. And would you like to take this moment to get to know this feeling in a way? I ask a lot of permission. And even if they say no, oh no, I don't want to stay with compliments, because the surest way to go right up from the bottom of the triangle to a defense is to see someone talk about a compliment and they shrug it off and they roll their eyes and they go butt right away. But if you bring them back and say, well, what if we get to know this feeling a little bit, and what's it like inside, and what inside is telling you that something good is happening? And then holding them to that as much as they can take that, so that you're, the way I envision it in my head is they're literally taking up more space in the world, and you're going to hit that window of tolerance very soon, and then start to titrate between regulating anxiety when it starts to go up, and, you know, stop what we're doing, let's ground and breathe and calm, and then let's go back to that pride in yourself or that joy.
So one thing that I'm hearing you say, Hilary, is that, you know, really being conscious with the person that you're working with about what affect they will be experiencing with you, and then encouraging them to stay connected with that affect in relationship to you. And you're just going to be helping people get comfortable with the adaptive affect, and then if they get anxious, trying to help regulate the anxiety so that they can come back to it and be with you.
So well said, exactly. And that, again, the emphasis on that adaptive affect, like somebody just wrote about anger, going to one, just being comfortable with it, and then taking that anger and making constructive use, either agency, right, building the core of the self. This is what I want, this is what I need. And then the last step is helping somebody channel that into is limits and boundaries set in kind and firm ways. It's you know, it's this last step of what to do with emotions to make, once you get to know them so that you can make good use of them, is really all about the presentation and good communication skills and making sure you're heard and that you're not raising somebody else's defenses.
Well, and what's so wonderful about your book is a person actually has a chance to read this book on their own, you know, to explore all the different affects, and to have an idea of what they're comfortable with, what they're not comfortable with, so they can come to a clinician and say, listen, I need some work on this emotion of anger or pride, whatever it is. And one thing that I'm noticing in the chat is that, you know, we in psychotherapy use different terms for the same concept. And so we're talking about positive affect, we're talking about adaptive affect, expansive affect, core feelings. So there's a lot of different words that we use that really mean, you know, the emotion that you're able to experience and express inside with another person. And that's what you're inviting your clients to do with you, is to be able to share these feelings with you and reap the benefits.
Absolutely, just as a core concept, right? That we don't, that we, you know, I've come to think of mental health as the ability to experience. I'll just stay with the change triangle model. The 7 core emotions with minimal amounts of inhibitory emotions, anxiety, guilt, and shame, so that you can make use of them. And then once you know what you're feeling and you have access to that, then you try to figure out what to do, whether it's to process something on your own with a therapist, or where you're actually going to communicate with somebody what the need is, what is adaptive for.
Right. And you know, one thing that I enjoy so much about your model is that on the feeling pool, you really identify, like, I think there's like 7, the calmness, curiosity. I need some help from you on this.
Oh,
like,
and the open-hearted, like when you're regulated.
yeah, when you regulate it, what is it that you're experiencing inside? You have a list. Can you share that with us?
Yeah. So that I adapted. So the idea here is that, and the encouragement is that when you don't bury your core emotions, when they can flow, and you can tolerate the strange sensations that all emotions create in the body, right? That then you get familiar with them, and you're not scared of them anymore. When you can process an emotion either alone or with a therapist, depending on old and new, how much trauma, how much work someone's done, you're regulating, you're integrating the brain, and you're regulating the nervous system, and then you drop into a state. In AEDP, we go through the different states from defense down to the state called core state, which is a regulated nervous system. And in that calmness, this I borrowed from Richard Schwartz in internal family systems therapy, where he talks about the essential concepts of the self. You're calm, you're curious, you're connected, you're confident, you're compassionate to yourself and to others, clear in mind. All these things happen. We know this is the state that we all want to spend more and more time where triggers can happen, we can see them, and we can process the emotions that are coming up, know what's present, know what's dovetailing on the past, and get back as soon as possible to that state, which again is not a state that there's no reality in spending 24/7 in that state, but it's just a good, I like these idea of maps of where we're going.
Right.
And so even sometimes at this point, if you know the C's and you're triggered, you can even just try to make a shift. Like, let me find some calm and clarity inside, and let me right away shift into compassion. And sometimes you can even just make that shift by looking for it.
Right. And what's so interesting about your work is that you have the 7 C's, which tells us, okay, this is how someone should be feeling if they have a balanced triangle, if they're connected with themselves and connected with another person. And then on top of that, you're paying attention to the positive affects and helping people get more comfortable with all their different affects.
Mm-hmm.
And then the question that I have for you now is, like, what about those uncomfortable feelings or those maladaptive feelings? Like, what do you do if someone is experiencing guilt or shame? And how do you handle that? If like, for instance, you're working with pride of self and then suddenly guilt comes into the picture.
Yeah, no, it's a huge and important question. The way that I teach it, and which is informed by Diana Foch's work in AEDP, is that if you're you want to transform inhibitory affects and you want to deepen core affects. So, and there's different ways. I talk about it that all in the book, and I hopefully in certain blogs I'm addressing these things. But there's different ways to lower. When someone is anxious, right, we move into anxiety regulating techniques. And the primary ones that I use in session are grounding and breathing, which is really how I start. If a new patient will let me from the get-go, I'm training in grounding and breathing. And I always laugh because before I kind of got into all this experiential stuff, if somebody told me to ground and breathe, one, I would just be like, that would be the most annoying thing in the world. And two, I really didn't understand how it would help. And now that I understand the vagus nerve, and now that I've been practicing this for over a decade, that's the 2 most important things. But it can take sometimes years before you sort of just clicks in and you get it. But I think personally, on a personal daily basis, grounding and breathing is my go-to. And happy to talk about that more. It's kind of interesting because it's such a small thing. We all use it and throw it around and you read about it. But it's the same reason I never wanted to floss my teeth until I went to dental school. That's what I got out of it, because someone explained it to me. And then now I floss. And I recommend all of you do too. I'm happy to explain that. So grounding and breathing are great ways to lower anxiety. And in AEDP, we use the connection very intensely, because there's nothing more comforting than being with a sort of an older, wiser, safe other that says, no, we got this and you're going to be okay. And even if you're having a panic attack, I'm right here. Look me in the eyes, feel your feet on the floor. Let's breathe. There's nothing.
It's so fascinating. It's almost like you're teaching people how to floss their own emotions and to be comfortable, right?
Yes, but similarly, just the basic education, because we live in a world that's largely emotion phobic. And particularly, I think my heart goes out to men, if I can be gender biased for a moment, because they're taught from the earliest age to stay away from tender emotions, and that it threatens really everything about them and creates shame. And so this idea that if you can give a little bit of education, a little bit, like emotions just are, or emotions in the body, or anxiety is a signal to look for underlying core emotions. Like those three things get people interested. Like that's what gave me like, oh really? Oh yeah, that makes sense. Tell me more. So it's that idea of providing a basic of a left brain education that gives someone enough confidence to have the courage, right, to let go of their brain. We live in our head because it's safe there. Because once you go below the neck and you start to feel the sensations that emotions have, it's like, what's happening for me? And because they're wave-like, it's scary. You don't know how big it's going to get. So helping people have metaphors to understand that you can hold your nose and jump off a cliff into the world of your body. And it's like, these are the ways that I help people get into their body a little bit. You know how when you notice if you're hungry or not, you're actually feeling your stomach a little bit. Excuse me, you're going into your body. Or when you stub your toe, you know the pain is coming and you are letting it rise, rise, rise. And then you know it's going to subside. And that's what it also is like when you're riding the wave of a core emotion, that they have like a time limit of maybe 2 minutes. And if it's a pure core emotion, it will rise and then fall. And when you can tell people that and give the science or the phenomenology around that, and then have people read a story in a book where they can look at it from a safe distance, and then, oh, here's a tiny little exercise you can try, a little gentle exercise to scan your body and notice, then you're on the road to being able to teach something effectively, I think.
So Hilary, I'm wondering what is your take on irritability? We have someone who's asked a question about, irritability. Is it unprocessed core emotions or not?
Yeah, I mean, I think of all those things, like irritability, I would call a state. And to me, a state is a mix of stuff to be determined what is in that. And so that would be, if you're irritable, I would probably say to someone, I would validate it, because who isn't irritable right now in many ways. But I would say, I know what irritability means to me. What does it mean to you? Can we put some more language on it? And then I would listen and then try to get a more of a feel. And then I might say, are you saying that you're angry at someone? Tell me, what did they do? Just to learn a little bit more till we could figure out together where they were on. Was it defending against something? Was it, a lot of people I think get irritable because they feel bad about themselves. A lot of people get irritable because they have a mix of emotions, and sometimes it's just anger and they don't want to say that.
So you're really helping us understand the importance of just exploring and being curious with our patients about like what they're experiencing and what it might be about, like what's driving the affect.
Yeah, curiosity and no judgment are the pretty much bedrocks. Like I say, I try to, again, invite, can we be curious? Can you approach yourself with curiosity and compassion for yourself, and try to leave, I say, can we try to leave judging parts in the waiting room? I validate that they're there. It's really, I've learned that in trying to tell people not to judge themselves, it's very easy to shame them into thinking, oh, I'm bad because I'm judging myself. So trying to be very aware of those type of.
Right. I mean, that's a really good reminder, just how destructive shame can be in this process, and to be aware that people might feel ashamed, when you are pointing out defenses or even anxiety sometimes, that they can feel like they're not doing it right.
Yes.
You need to do it better. And one of the greatest problems culturally is this lack of emotion education. And if people could just understand their emotions at a basic level, then they have a greater understanding of why they shouldn't feel ashamed,
Exactly.
for feeling the way that they are, or thinking the way that they are, or sometimes acting the way that they are.
Exactly. If they understand their own emotions and they understand other people's. And because what I love about this is it's universal.
Mm-hmm.
So we really can use it to try to get along and have a more loving, compassionate world. I think the emotion education is a real missing piece to
Right.
what we need. And yes, and that goes back to your question about transforming. We were talking about lowering anxiety and transforming shame is how we refer to it in ADP. And I'm very interested in shame. I bring up the concept with patients very early on in treatment, if not the first session, naming it, explaining it as an affect, and teaching it so that we can be on the lookout for it, because it's everywhere. Certainly people come to therapy, it's like asking for help. We're all taught to feel ashamed about that, and at least in the United States culture. So I'll pick yourself up by your bootstraps and just get over it and all that stuff. So working with shame is something that is so crucial, and there's a couple of quick tips about that I could quickly mention is I can't remember. I think I learned this from Janina Fisher. She gave me two really good tips years ago. But one is to never talk about shame in the wholeness. Like you always, when shame comes up, you always say, "Oh, the part of you that feels shame," and that in itself is de-shaming, because shame is so excruciating. Talk about visceral, the opposite of pride and anger. It's an annihilating experience, and it's important to look for the somatic markers of shame in a session: downcast eyes, downcast head, pulling away, looking away, and to be able to say, "I'm wondering if a part of you is experiencing shame." And then I always ask, can that part of you, I say this is very hard to do, but sometimes someone can do it. Can you imagine that part of you coming out and sitting with us so we could help it understand what's happening right now? And the way to transform shame is usually to find out its origins, right? We're not born feeling ashamed. We learn it in a social context in trying to stay connected.
Well, that's so interesting, Hilary, because what I'm hearing you say is that you're helping your patients increase their awareness of shame, and at the same time take a pause and look at where did it come from? What are the origins of the shame? And that sounds so much easier than it actually is to do.
It's very hard. It really depends on the person. Sometimes, they can part something out from the very first session, and we can get an image of that, that shamed part, a little girl at age 6 being bullied by their brother, or, there's always a story. And sometimes you try to part something out, and it's not a part of me, it is me. Because these things can start, especially 0 to 3 before language, with particularly neglect, emotional neglect. The shame is just deeply, deeply wired in.
Well, and it sounds like you really look at each person as an individual and try to understand, like, what is their map of emotions. Like, some people might react differently than other people. And I'm just hearing how important it is to just look at people as individuals versus making assumptions of how emotions are for them.
Yes, I had many therapists, and one of the number one thing that really would bug me is assumptions. So I try not to make assumptions when, especially if somebody makes an assumption and it's wrong. There's no reason for it, because you can be endlessly curious, and somebody, when they use their own words and you use those words, or you say you're going to reframe it before you reframe it, I think it helps a lot build trust. So yes, I'm with you on that.
So Hilary, before we open it up to the group, because people are going to want to ask you questions, is there anything that you want to say on the power of the hug?
We could do another talk on that. I started to I ended up getting interested in hugs and what I'm really calling therapeutic touch, soothing touch, because from a patient who had early neglect that would have, when she was in a collapsed child part, really traumatized person, she was abused and neglected, she would have an experience where her skin would hurt, and asking what she needed. And I envisioned like a baby, what she needed. It said it needed to be held. And just the naming of that, just it blew me away. It got me so curious, and it made sense about, we swaddle babies, the need to be contained, the need to be held when you're having affect, especially as babies having, I do relate to the babies having rage and all the core emotions are wired in, perhaps sexual excitement, not so much until adolescence, but still even, sensual excitement. So it came as a byproduct of that, and another patient who really wanted the touch. And I had to, being trained as pretty much a traditional psychoanalyst, like that was like to touch a patient, when somebody wanted to, in psychoanalytic training, when I would come into supervision and someone wanted to even shake my hand, we'd have to analyze the hell out of it. And so I had Freud over my left side, saying never do that. And I started to get curious, and I researched the ethics around hugs. And there's nothing in the APA or the NASW, the National Association of Social Workers, or the American Psychological, that prohibits hugs. The two prohibitions are you can't have sexual relationships with your patients, and you can't do business with them. And that was interesting to me. And so I had started to allow myself to work with fantasy hugging, imagining me hugging, and then hugging, and wrote an academic paper, which I'm happy to share with anybody that wants, that's in the Journal of Transformance, which is the AADP journal. And then I just did a lot of research for that and was very interested by the benefits of therapeutic touch and holding. I swaddle patients in the room, I hold their hands, and I hold them, I stroke their heads sometimes depending on what they need, and never without permission, never without kind of analyzing it at first, what it would mean, the fantasy, knowing that sexual feelings can come up and that's okay. We just have to separate them out. And again, because I work with parts and all these things that I've been doing, but I'm happy to talk about that and to come on and do another. It might be shocking and horrific to some people, and that's totally fine. We can talk about that.
What I'm hearing is so many of us are experiencing virtual hugs now that we're working on Zoom, and so I guess there's a lot of curiosity these days about hugging, because we are not in the same room with one another, and it just feels so right to just say, okay, goodbye. I'll give you a hug goodbye today virtually, and it seems like a way that people are saying goodbye to one another.
Yeah. So. And so you can even take that up a notch if you do that with patients or with each other. And what I kind of give some instruction is, eyes closed or eyes open, to let yourself hug yourself, and to remember, if they've had a hug with me before, feel, the instruction is, can you bring up the memory and feel my hands on, the way that I hold you, feel my hands on the back of your head or on your back, and really turn that into an experiential moment to, again, as you stay with something, right? Because the body takes much longer than our smart thoughts come very fast, but you have to sit with something for a while to kind of let it light up those neural networks, is how I think about it. So you can start to reap some of the benefits of hugging. I'm in the middle of I had a book proposal out for the public again on the healing power of hugs for families now who are quarantined together. Something called a therapeutic hug, which you need to linger for minutes and to let that oxytocin start to flow, which does wonders, but it requires really slowing way down, like you have to do with emotions anyway, and synchronizing breathing, and not pulling away until the huggee, the one who needs the hug, is the first one to pull away. And you have to be, in it to win it, and really you start to work with your own dysregulation from the intimacy. So it's challenging and interesting and helpful.
Wonderful.
Just to talk about.
Yeah, and I know you need more time on that subject, but I mean, just given what the challenges that we're facing today, I'm sure your words will be holding them with us all week. So we have time for. Go ahead.
I just want to say, as a cautionary tale, hugging, is not to be taken lightly with patients, when we're gone. And I really just want to say it requires thought and discussion and signing something, and but it's an intellectual discussion, and it's worthy of an intellectual discussion, as opposed to, oh, it's a slippery slope, let's forget it, which is how it sort of Freud relegated it to. Not going there.
Well,
say that as a caveat and for the caution. Yeah.
And Hilary, what we'll do is, if you can go ahead and send me any of the articles that you're referring to, and we'll go ahead and put it on the Slack channel so that it's available to everyone in the community, which at this point is over 100 people. And also we'll be sure to share it in our other personal networks too.
Okay, if people want, I don't know if I haven't, there's the New York Times published something called The Healing Power of Hugs. And then I have to even check if that academic article I'm allowed to give away. I think they make you pay a small fee for that journal, but yes.
Okay, thank you. Thank you.